Well, how often
my
have you
stomach
heard
really
someone
hurts.
say, my heart skipped a beat? Well, usually it is a positive expression, but for millions of Americans, that heart skipping feeling is a sign of atrial fibrillation, better known as AFib. Dr. Nicholas Costa from Novant Health joins us now to talk about this common condition. Good to see you and thank you for being here. We appreciate you.
Thank you for having me.
All right, so what is AFib and do we know what causes it?
So atrial fibrillation, or AFib, is an abnormal heart rhythm of the top chambers of the heart. We don't know exactly what causes it, but we know a lot of things that kind of lead to it. There's still a lot of research as to what actually causes it. But things that can lead to it: high blood pressure is very common, heart disease, or artery disease, high weight, just being overweight can be one of the common things that leads to it.
Okay, so now besides the irregular heart rhythm, what are the symptoms of AFib and who's at risk?
Well, sometimes people don't know that they have AFib, so it can be completely without symptoms. The common thing, as you mentioned, is an abnormal or a fast heartbeat. But other things people can feel as simply being fatigued, tired during the day, short of breath, especially when they exercise. Occasional chest discomfort can come along with it, but that's less common.
And who's at risk?
So many people can be at risk, and you said that not everybody would know that they have it or not. The more common people that are at risk are those who are overweight, those that may have sleep apnea, people with diabetes, with high blood pressure. These are some of the very common things that we look for.
All right, so now talk to us about treatments for AFib.
So the most important thing is that with atrial fibrillation is that it carries with it an increased risk of stroke. So that becomes our top priority in treating this. Some people will need to be on medication to help prevent that in the future if they have atrial fibrillation. Beyond that, treatment becomes focused at their symptoms. Now we have medications that can be used for it, as well as surgical procedures that can be used to help mitigate those symptoms.
And what else should people know about this?
So I think the most important thing that people should know is that they may not know that they have it, so it's important to keep up with regular checkups, to be mindful of any symptoms that they may have. Don't discount if you feel short of breath, if you feel an occasional palpitation. That may be an underlying symptom, something they should look into. We have a guide for it that they can reach online, so it's something if they're at all concerned they can look into and look at it online, or make an appointment with their primary care physician or a cardiologist.
All right, thank you so much. We appreciate you.
Well, thank you for having me.